Asthma kills about 10 people every day in the United States. It doesn't care if you're young, healthy, or minutes from the nearest emergency room. It strikes suddenly, silently, and too often, fatally. But what if your inhaler could predict your next attack before it even starts? This brings us to a new chapter in respiratory care. AI-powered smart inhalers. Artificial intelligence is transforming asthma from a lifelong risk into a data-driven condition. Smart inhalers are devices that track your symptoms, warn you of danger, and give doctors the power to personalize your treatment like never before. But with every breath logged and every symptom tracked, who's watching? Who owns that data? And what happens when health turns into surveillance? Let's get into it. Asthma affects over 260 million people globally and kills nearly 500,000 every year. This statistic gets even more frustrating when you find out that asthma is treatable and manageable. However, far too many people are still caught off guard, ending up in ambulances and living in fear of their next attack. So what's going wrong? Asthma is a chronic condition where your airways become inflamed and narrow, making it harder to breathe. Triggers vary, such as pollen, cold air, exercise, smoke, and stress. Some people have mild, occasional flare-ups. Others live in a constant tug-of-war just to breathe normally. For decades, the solution has looked the same. You get 2 inhalers, one to prevent symptoms, and one to rescue you when things go south. That's it. It's a system that puts you in charge of figuring out what works, when to medicate, how often to use it, and what's triggering your symptoms. Asthmatic people usually go for checkups once every few months, but a lot can happen in between visits. Some can forget to take their preventive meds, and too often, they primarily rely on rescue inhalers. For years, asthma treatment has been somewhat of a guessing game. But that's starting to change, because now we've entered a new chapter, one where inhalers don't just respond to asthma, they learn from it. Smart inhalers are using sensors, data, and AI to turn raw breathing patterns into something revolutionary. They're giving asthma patients something they've rarely had before: predictability. What exactly is a smart inhaler? Think of it like this. Your regular inhaler is a fire extinguisher. It sits there until something goes wrong. But a smart inhaler is more like a smoke detector, weather radar, and a fire extinguisher, all molded into one. At its core, a smart inhaler is either a fully integrated device or a clip-on sensor that attaches to your existing inhaler. It doesn't change the medication, but it completely changes how that medication is used, tracked, and understood. Here's how it works. Every time you take a puff, the device logs the time, date, location, and even environmental conditions like temperature, humidity, and air quality. That info gets sent, usually via Bluetooth, to a mobile app on your phone. From there, the app starts to build a personal health profile. It sees when you need your inhaler, how often, and under what conditions. And more importantly, it starts to recognize patterns. Using machine learning, the app might notice that every time your rescue inhaler comes out, pollen counts were high, or that you're often forgetting your maintenance medicine on weekends, or that cold, dry air makes your symptoms worse in the mornings. This information is extremely useful, because now, instead of reacting to symptoms after they happen, you're being nudged before they strike. Meanwhile, all of this data doesn't just sit on your phone. In many cases, it can be shared directly with your doctor, giving them an actual timeline that's much better than your memory of what's been going on between visits. No more guessing. No more, I think I used it last Thursday. Just clean, accurate data leading to smarter care. One of the biggest game changers in smart inhalers is real-time monitoring. Because here's the thing. Asthma doesn't just strike out of nowhere. It builds slowly, quietly, until suddenly, bam, you can't breathe. By the time most people realize what's happening, it's already full-blown. But smart inhalers are catching the early warning signs before your lungs even know what's coming. Take Jordan, for example. 15 years old, loves soccer, and has exercise-induced asthma. For years, he lived in fear of flare-ups. Sometimes during practice, sometimes in class, and sometimes in the middle of the night. 3 emergency room visits in 12 months. His parents were scared. But what about Jordan? He just felt like his body was betraying him. The app also began warning him when pollen levels were high, when the air quality dropped, or when it got unusually cold near his school. After a few months of tracking, the app noticed something Jordan hadn't. His flare-ups were happening more often on Tuesdays and Thursdays. At first, no one could figure it out. Then they realized those were his soccer practice days. His doctor used that data to tweak his treatment plan. Now Jordan takes his preventive meds an hour before practice. Since then, 0 ER visits, none. That's the magic of real-time data. The smart inhaler logs every puff, every time, every location. It doesn't just remember when you use your medication, it understands why. Some models even monitor how well you're using it. Are you breathing in too fast, too shallow, inhaling at the wrong moment? The device can tell. And if you mess up, it'll tell you to try again. That's crucial, because around 70% of asthma patients don't use their inhalers correctly. Doesn't matter how advanced the meds are, if your technique is off, you're not getting what you need. Smart inhalers help fix that in real time. And it goes even further. The companion apps that come with these devices aren't just passive record keepers. They act like digital coaches. They send reminders. They celebrate streaks. Some even use gamified features like 7 days in a row without a rescue puff to keep you motivated. And all that data you're building, it doesn't just sit there. The AI starts learning from it. It picks up on patterns, triggers, and subtle changes in your breathing behavior, things you might never notice, things your doctor would never see in a 20-minute checkup. But the most powerful part is the device warns you. If you've used your rescue inhaler 3 times today, ping. If you skipped 2 days of maintenance meds, ping. If the air quality near your work is dangerous, ping. It's like having a mini lung expert in your pocket, tapping you on the shoulder before things spiral out of control. That kind of feedback can literally be the difference between a regular day and an early morning ambulance ride. For decades, asthma has been reactive. Wait for symptoms, then medicate. Wait for trouble, then treat. But with real-time monitoring, we're finally flipping that script. We're seeing the attack before it hits. Using machine learning models trained on millions of data points from patients around the world, AI can start to forecast asthma attacks before you even feel a thing. It looks at how often you're using your rescue inhaler, it checks the weather, it monitors your sleep patterns, activity levels, exposure to air pollution, pollen, and temperature swings. It even compares your behavior this week to your historical patterns, also known as your baseline. And based on all that, it can say something no doctor ever could. The app will send an alert directly to your phone. And in some systems, your doctor gets that alert too. It's like having a weather radar for your lungs telling you, hey, the storm's coming, let's prepare. Think about what that means. You're not reacting anymore. You're adjusting. You're taking control. It's like Google Maps, but for your airways. It doesn't just show where you are, it tells you what's up ahead. And sometimes, it even reroutes you before you hit traffic, in the form of a health crisis. One of the best examples of this in action is Propeller Health. They were one of the first companies to build an FDA-cleared digital inhaler platform. Their smart sensors attach to standard inhalers, sync with an app, and tap into an AI engine that analyzes every puff. And the results? They're kind of stunning. In a large study, patients using Propeller systems saw a 57% reduction in emergency room visits. 57%! That's not a small nudge. That's lives saved, bills avoided, and parents sleeping peaceful at night. But here's the craziest part. Propeller's AI isn't just predicting attacks. It's also tailoring treatment. The system starts detecting trends most doctors would never spot in a clinic. Maybe you're responding better to one medication in the mornings. Maybe your triggers are spiking during your commute. It takes that insight and personalizes recommendations, sometimes even suggesting dosage changes or timing adjustments that doctors can approve directly. It's medicine that adapts to you, not to averages, not to population studies, to your actual life. And Propeller is not alone. Startups and medtech giants are racing to expand what predictive AI can do for asthma. Some are layering in smart rings, smart watches, even home air quality sensors to get a full body view. But at the core of it is one simple fact. You don't have to be surprised by your own asthma anymore. You can see it coming, and that changes everything. With smart inhalers, your doctor is also looped in. In the old model, asthma care meant a rushed visit every 6 months, maybe once a year. The doctor would ask, "How have you been feeling?" And you'd try to remember. You'd say something like, "Fine, for most part, I think. I had one bad week in April." But now, your doctor doesn't have to guess. They can see the whole picture. Every inhaler use, every spike in symptoms, every skipped dose. They're not flying blind anymore. And it's not just about the quantity of data, it's the quality. It's structured, continuous, and actionable. Unfortunately, asthma hits harder in low-income communities, especially among children of color. Environmental factors like pollution, poor housing conditions, lead exposure, and limited access to quality care make things worse. Often, these communities are the least likely to have consistent checkups or reliable medication access. But smart inhalers? They travel with you. They're portable, affordable, and scalable. Some public health programs are already distributing smart inhalers in underserved neighborhoods, and the early results are promising: fewer ER visits, better adherence, and more insight for overworked clinics. Because when everyone's using the same device, everyone gets the same visibility, the same data, the same early warnings, and most importantly, the same chance to breathe easy. That's the quiet revolution happening here. AI isn't just a tool for tech-savvy patients in big cities. It's a lifeline for the people who need it most and have been overlooked the longest. So yes, this tech is helping you track symptoms. Yes, it's forecasting risk. But it's also bridging the gap between the patient and the provider, between the individual and the system, between the haves and the have-nots. And the more it's adopted, the more that gap shrinks. But while smart inhalers are the perfect proof of AI advancement, we can't ignore the growing questions on challenges that may lie ahead. Let's talk data privacy. These devices collect an enormous amount of personal health information. Where you are, how you breathe, when you take your meds. Who gets access to that? Your doctor, your insurer, or a third-party cloud server halfway around the world? Patients need to know their data is safe, transparent, and used ethically. The line between helpful and invasive can get blurry fast. Then there's cost. Not everyone can afford a smart device, even one that could improve their health. Here is the good news. Some programs are starting to subsidize smart inhalers, especially for children, seniors, and low-income patients. But for this technology to truly make an impact, it can't just be a premium add-on. It has to become the new standard, like digital thermometers or insulin pumps. Also, let's not forget the human side of this. No matter how smart the tech gets, some people just don't want to be monitored, or nudged, or gamified. Maybe they don't want another app, maybe they're tired, or skeptical, possibly scared. That's okay. Adoption doesn't happen overnight, and healthcare is never one size fits all. The key is to build systems that are intuitive, respectful, and inclusive, that support people instead of overwhelming them, that feel like a helping hand, not a hovering presence. But I bet we can all agree that none of these challenges are deal breakers. They're design problems, policy issues, ethical dilemmas, and those are solvable. Because if the last decade of innovation has shown us anything, it's that the combination of AI and health tech can be powerful, transformative, and personal. Smart inhalers are proof of that. We used to treat asthma like a storm, unpredictable, dangerous, always one step ahead. But now, we're watching the clouds form in real time. We're tracking the wind. We're putting up the umbrella before the rain starts. And that's not just innovation, that's liberation. Because when you can see what's coming, you can breathe easy. So, where does asthma care go from here? If today's smart inhalers are helping us track symptoms and predict attacks, tomorrow's devices will take things a step further by actually responding automatically to your needs. We are already seeing early versions of automated medication delivery systems. These devices won't just detect when an asthma attack is coming, they will be able to adjust and deliver medication instantly, almost like an insulin pump, but designed for your lungs. This means treatment could happen before you even feel symptoms, providing relief faster and reducing the risk of emergencies. The AI powering these systems is also becoming more advanced. In the near future, artificial intelligence could diagnose the severity of someone's asthma all on its own. It could identify undiagnosed cases, monitor disease progression in real time, and suggest medication changes without the patient needing to wait for a doctor's appointment. This would eliminate much of the guesswork and delays that often make asthma management so difficult. But the future isn't only about individual care. We are beginning to see the rise of large-scale asthma monitoring systems that work on a citywide or even nationwide level. These networks will combine data from smart inhalers, environmental pollution sensors, emergency room visits, and health reports to create real-time maps of asthma risk, much like how weather apps forecast storms. Imagine turning on the news and seeing an asthma alert, just like a heatwave warning. Imagine urban planners using this data to avoid placing schools and playgrounds in high-risk pollution areas, protecting children and families before problems even start. Looking at the bigger picture, the long-term vision for asthma care is truly inspiring. We could move toward a healthcare system that is fully proactive, anticipating problems before they arise, optimizing treatment plans to reduce flare-ups, and significantly cutting down emergency room visits. Children would miss fewer days of school, parents would stress less at night, and people with asthma would experience a much better quality of life. Ultimately, we might even reach a point where asthma-related deaths are almost eliminated. While this won't happen overnight, the combination of smart technology, AI, and data-driven healthcare is bringing us closer to that future with every breath we take. If you or someone you love is living with asthma, now is the time to take control. Talk to your doctor about smart inhalers. Ask how AI-driven solutions could help you track your symptoms, predict attacks, and personalize your treatment. because the smartest tool in the fight for your lungs might already be within reach. If you found this video helpful, don't forget to like, subscribe, and share with someone who could benefit. Let us know in the comments, what's your experience with asthma care or smart health devices? We'd love to hear your story. Thank you for listening. Stay blessed and stay curious.